Hi everyone, it's so great to be here. I wish we were talking about far happier topics than this one. One of my biggest concerns with this whole Healthcare Act, something I've brought forward, is the fact that it's not just about all of us, or it's not just about women, but it's about all of us who are affected by this health care bill. And it even includes a potential tax on veterans. I'm going to tell you a story about a veteran. Her name is Octavia McMurray. She's a non-traditional caregiver. She is taking care of her two of her grandbabies, taking care of them. But she served. She served in the military for 6 years, in the reserves, in the Army, in the National Guard, but she doesn't qualify for VA health care. And because of that, she had no health care. Because she's a low-income, non-traditional caregiver, she didn't have access to Medicaid or any of the traditional forms of help. Now, she suffers from post-traumatic stress, general anxiety disorder. She has GI issues. She also has sleep apnea and high blood pressure. And all of this went untreated because she simply did not have the income to take care of her health care. With the Affordable Care Act, she was able to use the expansion of Medicaid to get health care finally. And so she's been receiving wonderful mental health counseling at Thresholds, which is a not-for-profit mental health counseling center in Chicago. She's taking better care of herself, which means she can turn around and take better care of those grandbabies who rely on her every single day to make sure that they grow up healthy and strong. But let me tell you, if these 13 men hidden away in that room somewhere have their way, she would lose her health care. She would lose her health care. And so it's not just about her being affected, it's about those two grandchildren being affected as well. And yet this is a woman who defended this nation. She served as a combat medic, and yet she can't get health care. What kind of a country are we? What kind of a country are we that someone who wore the uniform and served this nation can't get access to basic health care so that she can take care of herself and her grandchildren? We're a better nation than this. And this health care bill that they're working on, if it's anything like the House, it contains a tax for veterans. Veterans who served, who may not qualify for VA health care, or who qualify for VA health care and can't get care at VA, will find themselves facing a tax hike. They're going to lose their subsidies, and they're going to pay thousands more every year for health insurance. And folks like Octavia, who worked hard, who shows up every day and takes care of those grandchildren, she won't have access at all because Medicaid will go away. We're better than that. And I think most Americans, if they understood what was happening in that close room, would certainly rise up. And I think that's probably why they won't tell anyone where they are, because they know that we would be furious. And so let me tell you, this is about women, absolutely, but it's also about our children. It's also about our brothers and our fathers and our mothers. All of us are in this together. If we don't take care of one another in this country and provide health care so that all Americans can afford to be happy and hardworking and productive, then we will suffer as a nation. And let's do it for someone like Octavia, because after having served our nation, she doesn't deserve to be left on the sidelines. All she wants to do is to live a productive life, take care of those grandchildren so that they can be the next generation of Americans, to maybe someday follow in her footsteps and wear combat boots and serve in the military as well. Thanks for letting me be here.